A lot of people have been having pain in the upper neck, back, shoulders in the clinic lately, so I wanted to get together a little video for you to do some a DIY home care in between visits. Today we're going to be talking about the scalene muscles. Your scalenes are starting in the neck area, and they're coming down into the upper chest cavity, attaching to your uppermost ribs and the back of the upper part of the thoracic spine. So this is an important muscle to know because it creates pain in a lot of different areas and areas that are not at the site of the muscle itself. So it can be a little bit confusing. Typically you'll see pain that comes down into the chest a little bit. You might have a little bit of tightness in here, this nagging chest pain. Other side as well, because you have scalenes on both sides. You'll oftentimes experience pain that goes into the back, the shoulder area, and the rhomboids, or the levator between the scapula and the spine, and you'll be digging around back here and nothing will make it better. That oftentimes is this scalene involvement too. The other weird thing that the scalenes will do is they'll create pain that goes all the way into the arm. It'll make your hands, fingers, thumbs numb and tingly sometimes. That happens a lot with people that sleep with their arm over the head like that. It really tightens up this area. So knowing how to take care of this area is really important to just get rid of and treat all those nagging pains in the area. So the muscle that we're looking for, its exact location is going to be on the neck, and it's going to be between two other big muscles. So you have your SCM, your sternocleidomastoid, right here. This is not what you want. This is going to be your forward boundary or barrier. And then you have another one back here, which is the uppermost part of the trapezius. This is also not what you want. The muscle that you're looking for is in between the two. So right about here, it forms a nice little triangle, which is also a scalene triangle. So what you're looking for is, well, first of all, let's talk about how can you know that this is really the problem. So let's assume that you have pain in this general area on one side. So for example, I typically get tight scalenes on the left side. If I want to know that this is the area that we're dealing with, what I'm going to do is I'm going to turn my head to the left. If there is a little bit of pain that happens when I turn my head to the left, that's a really good indication that the scalenes are involved. But I want to isolate that a little bit more and really make that pronounced to know for sure. So what I'm going to do is I'm going to turn my head to the left and I'm going to tuck my chin. This will really engage that scalene muscle. And if you have pain that happens when you turn and tuck, that pain can be down into the chest, that pain can be into the back, that pain can be a numbness and tingling into the arm. Pain can also be a little bit up into the head. That is a very good indication that it's your scalene muscle involved, and that's where we need to work out. So what we're going to do is we're going to look for tender spots in these muscles. There are a couple muscles lying one in front of the other. So what we're going to do is we're going to palpate the base of the neck. So the base, side, and a little bit front, and we're just going to work from the front to the back. So with your fingers of your good hand, you're going to palpate the painful side of the neck. So we're going to just kind of feel in here, find anything that's tender. If you go too far out here towards the shoulder, you're going to lose it. So you want to stay close to the neck. Really, we are talking about neck muscles here. If you're very sensitive, you can feel the individual muscles. But really, what you're looking for is just a really painful area. So we'll find them in a row, starting at the base. You might find a couple that are together, and then you also might find a couple as you move up into the neck more. Just remember to stay between the SCM, and the trapezius. So on myself, I typically get really tight scalene muscles right about there. So I'm just going to hold that, and as I hold that, I will predictably feel a little bit of numbness and tingling going down out into the shoulder and down into the arm. That's a positive sign that you have found the right spot. So how we go about opening up this area and relaxing them is really the opposite of how we determine that the area was involved in the first place. So what we want to do is we want to take our head and extend it towards the good side. So more or less in an ear to a shoulder stretch. You want to hold that. Should feel pretty tender in here. You can rock the finger back and forth a little bit to help open it, but really just holding it is very good to do in and of itself. So as I'm compressing, and I'm not being terribly afraid to put a lot of pressure here because due to the tenderness of the area, I really can't, so I'm not really worried about injuring anything. I'm going to just start rocking my head back and forth, extending, contracting, extending and contracting as I hold that muscle. And the extension under that held compression helps to open that area up. Scalene muscles are nice in that when you start working them out, they usually are only tight because they've been neglected for a long period of time. So typically they tend to respond pretty favorably unless yours are chronically tight or there's been some real injury to the area like a whiplash. So the next thing we're going to do is I'm going to add some variation to this and a little bit of a deeper stretch. I'm going to continue to hold. I'm going to extend to the side. Now what I'm going to do is I'm going to start rotating the head so that my chin goes up towards the ceiling and then back towards the floor. Up towards the ceiling and then back towards the floor. I'm just going to continue in this rocking motion, and I tend to work out these muscles pretty frequently, so in a short order I can feel it start to release. That numbness in that arm goes away, that numbness coming into the chest goes away fairly quickly. So that's a really good stretch that you can do at home. Take about 1 to 3 minutes a day. Hopefully this area will open up as you're doing it. If not, that means it's just a little bit tighter. So what you want to do is you just want to do it a little bit more consistently. So in the morning, at night, for a minute or so, just work on it. And eventually over time that area is going to really open up for you. And you should feel the pain, the referred pain coming down into the arm, the chest, the back start to go away. Typically these muscles get really tight due to paradoxical breathing, for example, if we breathe too much with the chest and not with the belly. It can be a sports-related injury with a lot of pulling, like a pull-up or a chin-up. Other things that have a pulling motion, like starting a lawnmower for a pull lawnmower. All of those things where you're pulling something towards the body, towards the chest, that can overload those muscles too. A nice little acupressure point that you can use for these muscles is a spot on your arm. It's going to be between the 4th and 5th knuckle. So you have the 4th knuckle and the 5th knuckle, and if you have an equidistant depression there, so what you're doing is you're just finding a spot that your finger falls into that's about as far away as these two knuckles are from each other. What you're going to do is you're just going to really dig your hand into that and hold that. And when you press that, you're just going to move your head from side to side and work that muscle out. Pressing this pressure point tends to relax those neck muscles, gives you greater range of motion, takes a lot of the pain away, especially takes the pain away in the moment, and as it's taking away the pain away in the moment, it allows you to stretch that muscle farther and help work it out. So those are some quick DIY home tips for you to get you through from one visit to the next. Hope you found that valuable. If you have any questions about that, be sure to ask next time in the clinic. And take care.